If you run 15-minute injury screens, you're going to want to watch this video. We're going to find out what's causing Caitlin's knee pain in less than half of that time.
Check it out.
Tell me about your knee pain.
I started feeling it last week during a set of squats.
Okay, what did you feel?
It was like a deep, strong ache, almost sharp, pretty deep in the knee, kind of lateral.
Show me, like with your fingers.
Like through here.
All right, so kind of in there, but like feels like it's inside of the knee. When in the squat do you feel it? Is it when you're deep in the squat, when you're starting to come out of it?
Yeah, so sometimes it'll be when I'm holding at the bottom of a squat, but mostly when I'm pressing up out of it. Like the moment I start to press out of it and then the whole way up.
Weighted, unweighted?
Both.
Okay. How often are you doing like pause squats when you're hanging out in the bottom of the squat?
No, I noticed that when I'm just like bending down to get things off the floor, like squatting down to get things off the floor. I haven't been doing any pause squats.
Gotcha. So then if you don't do a deep squat, you don't feel it?
Not really. There's a little bit of irritation, like almost getting into extension, but it's not as bad as in full flexion.
Gotcha. So really full deep squat, and as you're trying to come up out of the hole, maybe a little bit of irritation, even if it's not a deep squat. Same spot. All right. Anything else?
I get a little bit of pain that I noticed here when I was kneeling, of all things, yesterday. So it's also when I straighten my knee really strongly.
Okay. So two pains. Pain A, or pain 1, is going to be the deep posterior lateral pain, and then this front pain is going to be pain B, or pain 2. Cool. All right. So it's just squatting for pain 1 that brings that on. It doesn't happen with like going down the stairs or just sitting for a period of time, anything like that?
No, it catches me just anytime I'm going from a squat position into a stand.
Okay. Any numbness, tingling, anything in the hamstring, anything traveling down in the calf?
Nope.
Okay, cool. So let's look at this pain first, and then we'll look at this pain here. Clarification about this pain: when you're kneeling, right? That's when you felt it. Is it the only time you felt it? Besides when you squeeze your quad, do you feel it any other period of time throughout the day when you're going down the stairs or sitting for a long period of time, or lifting at all?
Very mildly when I was jogging yesterday, but like no, not really.
Okay, cool. All right, go ahead and lay down. So we're gonna start on this side, and I always pick out something actually that, like, if I can, on them that allows me to remember what side it's on instead of thinking left, right. So for Caitlin, I'm like, it's the side she's got her watch on. Pretty easy, because I'm gonna stand on this side the whole time too for the camera, but just a little thing that I do, or the pink sock instead of the purple sock. All right, so non-painful side, go ahead and bend this knee as much as you can, right? And then match it with this one. How does that feel there?
Fine.
No discomfort? All right, go ahead and straighten them both out. And then keep this knee touching the table, and then try to lift your heel up off. Good. And then how about on this side here? No discomfort with that? Perfect. All right, I'm going to move you, and you just let me know if anything causes discomfort as we go along. Normally, I would go to the other side of the table for this leg, but I'm going to stay here for the video. So if I just bend you here, feel okay with that, right? And none of this causes any discomfort in the knee there, right? And then if I push here, is that okay? If we lift up here, you okay with that? Perfect. And then on this side, start with the same thing. Feel okay there? No discomfort with that there. Good. And then if we go into flexion, if I just bring you into this overpressure, no discomfort here. All right. And if I push down here, no discomfort. And then if we rotate internally, any discomfort there? All right. And then if we go the other way, any discomfort with that there?
I feel it a little bit there. I forgot to tell you that if I'm just like here hanging out and I rotate here, I feel it.
Okay, so you feel it a little bit.
Yeah.
There. So then if you relax and I rotate you here, do you feel that?
Not so much.
Yeah, so there's a compressive component to it, right? Because when she does it, go ahead and do it. It's using muscles. Anytime muscles activate, it compresses the joint that it crosses. So when we have a little bit more compression, you feel it there. So if you say relax, if I push here and do this, does that create any discomfort?
Not very much.
Yeah, a little bit though.
Yeah.
So nothing here. And when I compress a little bit, you feel a little bit? Okay. So it tells us a little bit about the joint, right? And a little bit of compression. So maybe it's something in the joint because that's not activating any soft tissues. So then we come down here. If I start by rotating you, do you feel it there at all?
Mildly, very mild.
And as I bring you further
That gets
here,
worse.
it gets worse. Okay.
Yeah.
And then if I just put my hand in here and we rotate, you okay there? no discomfort. And as we come down, with a little gapping force. Feel anything there? Okay, so better there. Right, so we've seen that when we compress the joint, it gets better. And when we add some gapping to the joint, create some space in there, when we compress the joint, it gets worse. When we add a little bit of gapping to the joint, it gets better. The rotatory component, right, it's non-contractile. So it's got to be something inside the knee. Probably the posterior horn of the meniscus is a little bit irritated. And that's what I would come to. I wouldn't explain that to the patient. I wouldn't say, you've got posterior meniscal tear or irritation. I don't think it's torn. I think it's just a little irritated. I would just say, yeah, it seems like you get a little irritation on the inside of the knee in the deep knee flexion, because when we bend the knee all the way, just the way the knee glides, the things in the back of the knee tend to get compressed on the inside there. It seems like there's a little bit of irritation to deal with. And then from there, we got to come up with the why and do a full examination. But that is the knee pain that you're getting. It's going to be posterior horn of the meniscus, right? It's going to be the inside, intra-articular things. So then the second pain here, right? If we do this, no pain with that, right? And if I just push down on your kneecap here, how does that feel?
It's not comfortable, but it's not painful.
Okay. And if I do a little bit of this?
Yeah, I don't like that.
You don't like that, or that reproduces pain?
It reproduces the pain when you glide that way.
The same pain that you're familiar with up here. So pain B is reproduced when I push in. All right, and then if I go digging around underneath here a little bit, is any of that tender?
You just had it a second ago.
Down.
Yeah, that's kind of tender.
And if you look on this side over here,
Nothing.
That's all okay.
Yeah.
So around underneath there.
Yeah, that's fine.
Cool. So tender when I push and drag that way, tender when I slide the kneecap over and palpate underneath of it laterally. So we found pain A and we found pain B. One is going to be intra-articular as it relates to the joint, likely meniscus related. Pain B is going to be a patellofemoral pain because it hurts when I'm compressing the patella into the femur and grinding it around. And then also when I'm palpating the underside of the patella, reproduces her same pain. So let me know exactly what's going on with your knee, right? Doesn't tell us what to do about it. We need to do a full evaluation for that. But that's a quick little bang, bang, boom injury screen there. Right?
Bang, bang, boom.
Bing, bang, boom. Not bang, bang, boom. Right? But then I would be very interested in what's going on with the hip, what's going on with the ankle, what the mobility and strength of both of those things are. And honestly, the first thing I would have done in a real evaluation is have her get up and take a look at her squat and play with it in the different positions. Because I'm willing to bet if we just did a hip-dominated squat or hip-dominant squat, then you can squat without pain, right? So you can still keep squatting heavy with box squats, hip-dominant squats in a range of motion that doesn't cause pain to keep you moving and active while we rehab this thing without telling you, stop squatting. Make sense?
If you found this helpful, we have an entire 12-week mentorship program where we help you become part of the 1% that catches what 99% of other clinicians will miss. Click the link in the description box below to book a call with us to see where the holes in your clinical skill set are. Once we identify where the gaps are, we know exactly how you can excel at becoming a rehab authority.
We'll see you there.